Thank you so much for the warm welcome and very, very warm welcome to Kaustav, Arun, Suhas, Shavankar. Always a pleasure speaking to all of you. You've been great friends of mine, great panelists in the past, and I would always, take the opportunity to speak to all of you. So, looking forward to today's conversation. I know we have a fairly, robust set of questions that I have in mind, and four gentlemen who know the industry as good as anybody else. So I think we are doing this at a time when, unfortunately, we see a spike in COVID once again. Hence, it's very opportune moment for me to do this because let's see how we're equipped now to face this scenario vis-a-vis 2 years back. And probably without wasting time, let me bring the first question up to you. See, how I see the entire world. I mean, this is a once in a lifetime opportunity for somebody to see a world changing scenario like the pandemic, right? So when in history textbooks, when we read history was partitioned into AD and BC, right? Modern history is going to be scripted in the pre-pandemic world and the post-pandemic world, right? We've been, how do I put it, for a lack of better way of putting it, been fortunate slash unfortunate that we had to go through this phase. So we know the world before the pandemic, the world after the pandemic. So maybe, Kostav, let me begin with you. I mean, like I said, I'll probably, this first question I'll have everybody sink in, because this is, I think, is a very important question, Kostav. How do you see the healthcare sector evolve from the pre-pandemic to the post-pandemic? It's a very, very open-ended question. Everybody has their own right to have their own view. I'll start with Kostav.
Thanks, Aplak. See, as you have very nicely mentioned, and I'll quote you somewhere in future, BC versus AD and pre-pandemic versus post-pandemic. So not just healthcare sector, but like all other sectors, healthcare sector has fundamentally changed, specifically in urban and semi-urban establishment during the pandemic. We have been several significant changes what we have observed in the healthcare sector post-pandemic. In my opinion, the biggest change is the emergence of what you call it collaborative and patient-centric healthcare delivery system. If you see, conventionally, the Indian healthcare sector operated in silos, such as hospitals, your private doctor clinics, your diagnostic labs, pharmacies, and so on and so forth. However, the pandemic has taught us that there is a need to integrate these different elements of healthcare and ensure that a patient is able to access care and treatment through the right channel at his or her own convenience, probably at the right price point and at the right time as well. Other change what I have seen is in the adoption of digital technologies. So, I mean, again, before pandemic, how many times we have seen this telehealth, wearable devices to monitor different body vitals while you're still sitting at home, health apps, adoption of electronic health record. I mean, specifically in a country like India, the digitalization of your health record, it's significant. So, if you ask me, the technology has now become a core part of the healthcare system, which was pre-pandemic more in-person and physical thing driven.
Kostav, I mean, I think you put it beautifully. In fact, it takes me back to a time, and I think I've shared this with you. I was fortunate to be part of a paper that Department of Biotechnology was authoring almost 10 to 12 years back around mobile health. Like you mentioned, I think, as they say, necessity is the mother of invention. I think the challenge was not about technology per se. It was the acceptance of processes and technology integrated in the healthcare. Because I think the pandemic forced us to be, and I could not have, I mean, I could not have had a better start than this person. You put it down. And in fact, to give it a more layer, because Arun has the experience of rolling out several nationwide projects, and now in his capacity as CIO with Gangara, I should. Arun, why don't you share your view? I mean, Costa, I think hit the nail when he says how how the ecosystem actually has started flourishing thanks to the pandemic in parts. Your views, Arun, and I'll then probably get Shubhankar and Suhas into this as well.
Yeah, like so, Kaustubh rightly mentioned that pandemic has accelerated a lot of digital initiative, particularly in the healthcare, because not only the healthcare overall ecosystem, the global ecosystem got impacted in the pandemic. A lot of e-commerce companies came up, home delivery systems came up. So not only the healthcare, but obviously because healthcare was on the focus in the center, so we are talking about the healthcare. But yeah, of course, I don't say that EMR was not present pre-pandemic. I don't say that telehealth was not present pre-pandemic. All these things were present in healthcare system. But yes, I do agree that pandemic accelerated these initiatives. And as you rightly said that it is a necessity, so people felt necessity of having these digital initiative into the healthcare system, be it telehealth or teledelivery, invoicing, touchless things and operations across the healthcare system. So that way I would say that yes, pandemic has accelerated each and every aspect of the healthcare initiative. I recall that there was a requirement of having a touchless invoices to the patient. There was a requirement that now patient were asking about the delivery of their reports on their mobile instead of having a physical copies. All the legacy clinicians, they have started doing the teleconsultation. People also become comfortable because in the earlier pre-pandemic era, people used to say, no, we need to meet clinicians in person because that is a different field. But now they have become a comfortable having a teleconsultation with the clinicians. So those things have accelerated. I would say that rather than getting introduced, I would say that the pandemic has accelerated these digital initiatives all across the board.
Yeah. And like you said, I mean, and I like to espouse on this, I will not say resistance, but because of proper use case. Not only were there hesitation from a patient point of view, but also doctors' acceptance of technology. Because
Correct.
the fact that they always wanted to physically be in touch with their patients, that has altered. Because I'll come to this, why I'm trying to bring this out. Shubhankar, I'll probably get you into the conversation. And obviously, Costa, Arun, so as whenever you want to pitch in, please do. Shubhankar, you are a part of a very large healthcare facility setup, right? And you span across several states. Now, considering that, because every healthcare provider has their own charter, uh, you know every organization in the entire life cycle ecosystem has their own charter. One of the biggest challenges for a nation like ours that is providing quality healthcare. This has been a challenge that we have been grappling for many years now, right? When we talk about, I mean, I don't want to again roll out the numbers of the number of beds per patient, so on and so forth. Uh, but if you know the numbers, when we talk about quality healthcare, we're still confined to urban metros, right? There is that issue of inadequate quality healthcare. The moment we go to, you forget semi-urban, going to just tier 2, tier 3 town itself becomes a challenge. This is a question probably no one better than a CIO like you can answer. And the question is as direct as one can be. Can technology help in mitigating this huge challenge of quality healthcare beyond urban metros? Shubhankar, over to you.
Sure. Just to add on first with Arun and Costa, what they told, basically, it's a pre-pandemic and post-pandemic. Basically, if I say for Indian healthcare scenario, it's a survival of the fittest. Where you have to survive in the business, you have to survive in taking the services from both sides, as a consumer and also who are giving these services also, right? So technology just help them to balance it out. Like consumer now more smart, more well thoughts before taking any medical decisions. Also, right? They are very much oriented with the digital world now. Now they knows not only for their nearest doctor, they knows the even outside India's doctors portfolio and what they are doing for a particular procedure or surgery, if I take an example, right? So the biggest challenge in healthcare, particularly in India, is a change of consumer psychology, consumer practices, basically. So that is the biggest challenge. It's not about that any consultant is not adopting the technology. It's not about the kind of any organization is not taking care of the quality of services. Right? Quality of services depends on everything. It's like for your consultant, for your whole process in built in your organizations, and how you are approaching to the consumers, and how you are taking care of the consumers, right? So one is your consumer behavioral change. First, that is a challenge, and second, to establish the quality of services, you have to define the processes. You have to define how your approach also to the consumers. So it's not like we have taken a star doctors in our organizations, and he will do everything for everyone, right? It cannot be possible. So what is your architecture to reach that doctor's efficiency? Suppose a patient sitting in a very remote area in India, how he can reach that star doctor? That is the whole journey, basically, and the technology will help you in that. It can be, yeah.
Shubhankar, it brings me to a point, and I open this to everyone. See, I'll draw an analogy here. Now that everybody is talking about ESG, environment, sustainability, governance, everyone, for instance, talking about EVs as EV cars, right? How they're good. Now, as a user, it is not while as a citizen, yes, it is my moral obligation to be more cautious and careful about pollution. But how typically a consumer operates that is government responsibility, not my responsibility. But an EV becomes a viable product for me when I see the benefit of that. So another way of putting this is, one is, a healthcare provider has a responsibility to reach out to unmet healthcare requirements of, say, semi-urban population. But this could also be seen as a business opportunity. The moment, because many organizations here are for profit, if you marry that, because, whenever you roll it out as a compliance indicative, there will maybe limited traction. But the moment you have a business imperative, it might have a much wider recall. What is your view to that? I'm just spinning this. Arun, Costa, Subhas, anybody who wants to take a dig at this?
So
yeah, I would say that it is. I take this Corona pandemic as a bliss in disguise, because it hasn't only accelerated all the digital initiative, the acceptability, particularly in the healthcare where digital implementation was slower. That has become a widely accepted by patient and the clinicians across the globe, I would say. Yes, in the metro cities and the major metro corporate hospitals, I would say that digitization were there, and people were getting facilitated by the digital initiative out there. But as you rightly said, that in the tier 2, tier 3 cities, patients' acceptability about the digital initiatives and the access to the digital health has become more prevalent out there post pandemic.
Precisely.
And furthermore, I would say,
Yeah,
furthermore,
yeah.
it's a coincidence. It's a coincidence that, yes, this Corona happened and it accelerated the digital initiative. I would take the opportunity here to mention the ABDM also, the government's initiative of the Ayushman Bharat Digital Mission.
Right.
Implementation at the right time happening out there to push from the government side also, because that has given the total healthcare umbrella, digital umbrella, I would say, across the nation to
Very
integrate
true.
healthcare, digital health.
Very true.
Yeah.
Kaustubh, you wanted to share your views.
Yeah, Arun and Shubhankar, they have covered the most part of it. But Aplak, where you left it, and I just wanted to pick from that particular side, that it's not just the job of one or two entities like government, corporates, NGOs, or charitable trusts to provide a quality healthcare to the remotest part of India at an affordable cost. It's actually the combined effort of all these parties to make the healthcare in rural India better. So Arun has covered most of the things, but if I just add one more to it, is the government of India is now diversifying the different practice of medicine, like Ministry of Ayush, so that all load is not being put onto allopathy itself. I mean, you have Ayurveda, yoga, naturopathy, homeopathy, and so on and so forth. Typically, I mean, if I talk from the Dabur standpoint, what we have done or what we are doing is that first we are making Ayurvedic product available to the rural market consistently and in a cost-effective way. Second, spreading the awareness. So through digital medium, I mean, if we start spreading the awareness, like it is being said that prevention is better than cure. Right. So educating and inspiring people towards the well-being, and that too through the digital media, can actually, help achieving the goal indirectly, but providing a better healthcare services to the rural part of India.
Right.
I would like to add one thing, Aplak, here with the Kaustubh here, that yes, we all have talked about the digital initiative and healthcare digital initiative all across. Pandemic has created the ripples across the healthcare security also, because that was something which was missing earlier.
Yes.
In the absence of the regulatory bodies in India, particularly.
Right.
So now people have become in the healthcare more security conscious about their data.
Arun, you rightly said, because there was not just a couple of years back, you never had the concept of doctor consultations on a say a video call and suddenly all your data is on freeware.
Yeah.
How do I protect that? So I'll come to that. There is a question that I focus on that. Then look at Suhas. So because it's always great to get a completely different view to this, because Suhas, you've been serving the healthcare sector for now almost close to a decade now. And in your experience, as we're saying, what is your take of technology adoption, the difference between what it was? Because all said and done, and I don't mince my words, healthcare was not the first adopter when it comes to technology. I mean, typically, if you compare it with, say, a BFSI or an ITITS, they were the early adopter of technology. But now, thanks to COVID in many parts, that gap has reduced significantly, right? So as your views to this, when we talk about people, processes, and technology, typically these are the three that we talk about for any wide acceptance. How have you seen, as a technology evangelist, the last 2 years really fructifying the role of technology in healthcare?
Okay, thanks, Aplap, and it was wonderful to listen into Kaustubh, Shubhankar, and Aruji. I think there is a slight mistake when you said that healthcare did not adopt technology. In fact, they were the first ones to adopt technology, right? The X-ray machines, the imaging devices, all those things. In fact, if you look at it, the real genesis of let's say, medical device. Okay, and that's where it is very important. So I'll just keep it there. Now, since we've been talking about pre and post pandemic and things like that, I think there are quite a few things that are going on in my mind currently. Yes, from a digital transformation standpoint, which means how effective it is, and also made it very clear that it has now become the core. right?
Yeah.
We've seen various industry verticals adopting in different fashion, but at the backbone of healthcare, if there is a digital transformation that has happened, it has started, I would say, maybe slightly before pandemic, but pandemic, obviously, as Mr. Arunji and everybody has said, and I allude to the fact that, yes, it has ensured that instead of happening in the next 6-7 years, it has happened in the last 2 years, 2.5 years. Now, who's benefited? Frankly speaking, I think the benefit has to go in the longer run to the lowest possible denominator in the society, right? And that's where technology plays an absolutely different role, not from an IT standpoint, not only from an infrastructure standpoint. Let's say, what do you want to do on the cloud? How secure is your data? What are the devices that are being used? Wearables, for example, is coming up majorly as an impactful, what you could say, device that will easily kind of reduce the low workloads that are there on doctors and physicians and so on and so forth. So that's one point I would like to mention here, which is it's creating a change from a healthcare perspective. Of course, the lowest possible demand in the society, what technology can do, what 5G can do coming in the next 1 year or so. See, for the person, the standard chaiwala or a vegetable vendor, technology is not alien. Okay. They use a lot of UPI paying methods. They scan everything. There are many times when they can actually go back digitally to procure stuff as well. So I don't think adoption from a patient standpoint would be really that bad. Okay, yes, they would like to see the doctor, talk to them, have a cup of tea, perhaps. That personal touch obviously will be required. Of course, if a surgery has to be done, the patient has to go to the hospital, right? So that is what has to be there. So from a technology company, what I feel is, and being part of this industry and seeing so many other countries also evolving, it's not that, I mean, look at it for that matter. Technology company, country does not have a central, what I could say, portal for COVID, right? The moment you had your dose, it immediately reflected onto the COVID portal. You could download the certificate and start going. That is not existing in such developed countries. So our adoption, frankly speaking, I'm amazed and proud of the fact that we've used technology to such a great extent. Now, where does it come? Does it come to the enterprise? Does it come on the cloud? Does it come on the end user devices? It is a mixed bag. So that's what I feel. I think people here are very important.
You gave a great example. In fact, I mean, the world, I mean, I'm just taking an analogy here. India has been at the forefront of UPI technology. And now it's exporting UPI to far more developed economies like Singapore.
Correct. Absolutely.
I mean, Arun spoke about, some of the government initiatives. The scale of those operations are baffling. We speak about countries like much smaller countries like Singapore and all that. They're smaller in size than Delhi NCR. So to roll it out in our capacity, I mean, it is
see the diversity with which it has to be implemented, right? I mean, the what you could say, geopolitical situations would not get into that. So many issues that were there till the time the government started taking technology as an initiative, right? And so, which means for me, what happens is it's more important. Yes, you do understand and feel that, yes, it's a consumer here, but ultimately, who's going to be benefiting? It's the patient that's going to be benefited, whether it is in person, whether it is telemedicine or health records, or maybe somebody who's there in an urban center wearing a wearable. And I did read somewhere that a person who was wearing an Apple, whatever, the wearable device could actually make it out, right? There is some health issue. Now, so there is so much of data that is coming out. Please understand this. I mean, that data is humongous. And how do you ensure that the data is, first of all, secure? Because that's where it comes to use blockchain technology, perhaps. Okay, just a thought process. These are the challenges that the healthcare industry is going to really face as we move ahead and deliver healthcare to everyone.
Right. I'll probably ask this question. This is specific to Arun or Shivankar because they represent healthcare providers. Arun, Shivankar, there are a lot of discussion around virtual healthcare, how the COVID has been a catalyst toward virtual healthcare, so on and so forth. But we also know there are challenges in providing virtual healthcare. I mean, it is not as straightforward as we make it out to look like, right? because we have a fairly large audience which is listening to us today, right? And the reason why they have all logged in is to gain from your experiences and understand how to mitigate. So, my question has two parts to this. One, some of the larger challenges when it comes to rolling out virtual healthcare in scale, not in not as a one-off case, in scale. The larger challenges of virtual healthcare in scale, and how to mitigate that, and the challenge. I mean, if I could probably ask you further, are the challenges more centered towards technology or people or user acceptance? Maybe I'll request Arun to take a dig at this first, and then Shubhankar, I'll take request you to uh, answer this question. Arun, over to you. Arun, you are on mute. Arun, if I may request you to unmute yourself.
I'm sorry. I'm sorry.
Please.
So you rightly said that, and answer is in your question itself, is where is the challenge in virtual healthcare? I would take it the clue from the ABDM again, because ABDM is the healthcare across the industry, and ABDM is a platform provided by the government to integrate overall healthcare. And when we drafted the ABDM technology across so major challenge was not the clinician, major challenge was not all the patient, the major challenge was the technology. So it was not that whether patient would accept it or clinician would accept it or the respective stakeholder would accept it. It was the technology, how to integrate, how to create and provide the infrastructure across the country which will integrate the whole services. How will you bring in the health exchanges which will be transferring the data from one hospital to another hospital? How will you bring in the consent management system integrating with the UIDI to identify the patient's identity and the clinician's identity and the facility provider, the hospital's identity? So those were the operational challenges. So far as the operation challenges are concerned, connecting patient and the clinicians are not from my perspective, because I know I was involved in drafting the whole concept out there. The major challenge is how to provide the technology into the healthcare system to implement this. Because once this is implemented, nobody denies the benefit coming out of it. You will be having a centralized EMR, you will be having a portability of the healthcare data across the country, you will be having a humongous, fruitful data of the country, geographical wise, gender wise, disease wise, to frame the strategy, policies, researches, everything. The pharma industry will get benefited, healthcare industry will get benefited, patient will get benefited, because you will be having a fruitful, real Indian data with you once the whole concept is implemented all across. But the challenge is why this particular concept, because it has been 2 years this was inaugurated, why we don't see the ABDM on the ground level. We have implemented ABDM in all the union territories. So ABDM is 100% implemented in all the union territories in the government hospital only. How many patients are there in the government hospital? So whatever was the captive, the implementation has been done, the digitization was done. But the main thing is the majority of the patient or the stakeholders are sitting into the corporate or into the enterprise world. So how to extend the technology to them and provide the technology infrastructure and the framework to them so that they can integrate it to it, and then they start transferring and using the services. So from my point of view, I see the technology and the infrastructure availability is a challenge to deal with this type of initiatives.
I admire candidness, Arun, and the way you put this. Shubhankar, your views to this, do you see a divergence, or what is your take on this?
I completely agree with Arun, whatever he told, but what I see that there is a gap in the whole concept of ABDM. There is a gap. Basically, first of all, if I go to the node level, like you take it any government hospitals at your remote area, right? What your digitalization means, it's just you're scanning your physical prescriptions and to keep it on centralized format, nothing else. Your hospital infrastructure cannot communicate with your digital app, basically, whatever AVDM had made. It's an app now, right? But the basic data and the unified data structure, government has already told that this will be the unified data structure for any hospitals who will be coming under AVDM structure, right? But all these corporate hospitals, all these even government hospitals are following that structure is not, basically. That is where the gap is. So we have conceptualized the whole thing, but the data ultimately which are coming is very few. If we take the examples, it's a very few data you are getting. Even see, first of all, there is a problem in synchronization with the private sector and the government sector. That is a huge problem. No private sector is actively participated in ABTM conceptualizations. I was a part of that in somewhere when I was working in Colombia, Asia. But after that, I haven't seen any hospitals, private hospitals, is very actively participating on those.
No, right.
Aplap, I would take opportunity here to clear the things. I think I feel it's my duty to explain it to the group also and to the healthcare fraternity also, because I see this is a huge gap where I keep on requesting on a different forum to the government also to emphasize onto the marketing and make the people knowledgeable like Shivankar and all the stakeholders, those who are supposed to implement these type of initiative. So there is a misconception as Shivankar has that people has to have a scanned copy and then integrate with the ABDM app, and that is not acceptable. This is not the case actually. This is not how the ABDM has been conceived and is actually. This is not the right forum. I can speak on the ABDM for hours, but just to summarize what is the ABDM. ABDM is where whatever way you are working, be it in a small clinic or a small diagnostics or a big diagnostic laboratory or a big hospital or a multi-specialty hospital or a multi-chain hospitals, you need not to change anything. This is the first concept. Whatever way you are working, you would be working. Only and only you need to integrate with the ABDM. And once you integrate with the ABDM, that means you will be certified by the government that yes, you will be able to share the data from one hospital to another hospital. When we say that you will be able to share the data, you need not to do anything else.
Taking the opportunity of sharing a data point. So when we ask our friends who've joined in for today's conversation, what are some of the top challenges faced by the healthcare sector? And these are all IT decision making of the healthcare sector, I think very interestingly, and I think that is why, data points like this help. 87% say enhancing consumer trust. I think it's a very, very valid point. If you look at it, I mean, they say all said and done, at 76% are saying improving patient engagement. So at the end of the day, as somebody said, that is the lowest common denominator. Right. So it's a great point that I thought I'll share with all of you. But moving on, because I'm just conscious of the time frame. And Arun and Shivankar, I'm sure we'll have several forums like this to deliberate on this further. Suhas, I'll get you.
Yeah. I'm sorry, I got disconnected. I don't know, some problem was there in the internet, so it got dropped.
Yeah.
So let me just complete because that is most important thing which I wanted to share with everybody out there, because this is a misconception all across the industry and people are carrying this. So actually ABDM is not doing anything and they are not asking anything. They are just trying to create the infrastructure where your data, only the link and the record with respect to a patient, can be shared from one data center or one I would say repository to another repository. That's it. If you have a hospital sitting there, Tata Memorial in Bombay, and you were getting consulted at AIIMS Delhi, so the request of the patient will go to the NHA, get validated, and then NHA or some of the health exchange will send the request to the Tata Memorial to release the link of that particular record of the patient to the user. That's it.
So, Arun, just I'll pitch on because I was involved in this when I was in Columbia, I mentioned. Basically, when these two systems integrated, the integrations itself requires some sort of APIs. It's a technology, basically APIs, where we have to push this data, patient data. It can be clinical, it can be basic patient demographic data also push to that portal, right? And to the central server, sandbox server. So I mean to say basically whether government has this kind of setup to push this data into that portal, first of all.
No,
So
no.
without this, how can they will save this data?
No. So we will discuss it. I would request Apurva to set up
We
a
will,
separate
yeah,
forum on the
Sure,
ABDM
sure.
because
I will, I will make sure we'll have, we'll make sure we have a separate discussion on this
yes.
because otherwise this is far too big to take it up for today's conference. But I'll
Right.
get Suhas into the conversation. Suhas, because I think everybody spoke about this, and I would like to you to discuss this in further detail. So, like we discussed, right? COVID has been a catalyst to expand a lot of digital transformation processes, right? It has also helped further the cause of at least IT, like you so as mentioned, technology has been there for several years. The use of digital transformation in the healthcare sector, but how does a CIO or a person who's responsible for the IT charter in their respective organizations balance technology modernization, security, and user acceptance? Because there are three. It's a triad. Like we understood, user acceptance is equally important with security. Because like I said, we speak about the importance and the benefits, say, of telemedicine. We were just getting into a debate about how ABDM is relevant, challenges around that. How do I protect? Because at the end of the day, when we talk about digital transformation, in 99 out of 100 cases, digital transformation is to do with data. I mean, digital transformation is almost equal to data transformation. How do I protect and secure data in a sector which has to be right now? Unfortunately, it's not as heavily regulated as we wish it should be. But I'm sure there are things in progress to make sure that it does. Where are we in terms of security, and what does the world of technology help? How does it help? I mean, for instance, there are a lot of terms that have come up from the world of technology. For instance, zero trust. Do you envisage a zero trust framework getting adopted in the healthcare sector? And so, what is your view to this, Suhas? Suhas, you are on mute, Suhas.
Sorry, you nailed it right. Zero trust. And you see, let's be very clear. Technology is not an impediment in terms of software services, in terms of implementation, in terms of infrastructure. I think various industry verticals have adopted it and are really very successful. So technology is not alien. It's there. Its processes are there. What I sincerely believe is there are challenges which are in a way slightly unique as well, but more or less are something similar. One, of course, is data. And digital transformation means you are working with data. And when you're working with data, it means you have to ensure cyber security of the data, right? You may be a small hospital where there could be a cyber breach, but at the end of the day, the patient's data is breached, right? And this is very sensitive and it can be used for multiple reasons.
Yes.
Let's not go there. So from my perspective, purely from a technology standpoint and not from an organization standpoint that I represent, yes, organization does help institutions in the healthcare industry to ensure that data is safe, either in the system or or the enterprise or wherever it is, because data breach happens at an endpoint, right? When the device tries to access the enterprise network, that's where the data breach happens. So security is very, very important. I feel it's also very challenging given the fact that digital transformation for healthcare has started slightly later, right? At least in India. And hence it becomes quite challenging because there is no central framework as such.
Exactly.
Right? Yeah.
So, exactly.
Yes, so I mean, primarily from a security standpoint, and because there are issues that are related to trust, not in terms of data, zero trust, but issues related to trust between organizations, between institutions, and so on and so forth. Right. At the end of the day, you're dealing with patients' health, and that is something which is very critical. So I believe organizations need to understand this very, very importantly. Either probably you are in hospital healthcare, or you are probably a physician doing what you could say a private kind of research as well, for that matter. You could be in any part of the medical ecosystem, right? There has to be a 360-degree view basis which it is given importance to data security. And organizations like us do have various processes, software solutions, and audits that we can do to ensure to figure out what is really the data. Now, to take it slightly different, I did mention the fact that there could be there could be probably a blockchain utilization in healthcare, right? Something that can be really worked out, because that market in blockchain and healthcare is going to be booming in the next 1 year, right? Estimated to be close to $1 billion or more than that. But $1 billion sounds less, but given the fact we are talking only about a healthcare data point standpoint, it is quite huge. So that's one thing I see. The second aspect is the patient does not remain with a particular institution, right? Patient may be moving, the patient's age would be doing. As you grow, maybe the complexities may get reduced, or maybe complexities might increase, so and so forth. So hence, I will lead it up to that only. Maybe that's where the digital mission of a country will probably help solve that purpose, not now, but maybe in the next couple of years down the line. Depends on how it is implemented. So that part will be taken care of. Utilization of new technologies is something which is very, very interesting, right? And one important aspect is you probably looking at AI, artificial intelligence. Most of the time, what happens is, let's say, for example, the job of the radiologist is not to deliver fantastic, excellent, photorealistic imagery of the patient's problem. That's the job of the technology, that you leave it up to us. The radiologist then is in a position to understand, with the basis of maybe AI methodology, what exactly is the nature of the problem. Okay, and then it goes to the physician or the surgeon. So that's where it is important, using AI-based methodology, using virtual reality, for example. I think it's very, very important and critical to understand how virtual reality can really help in surgery planning, right? Something which sounds very unique, but very interesting, and that can be done. Like doctors do not open up dead bodies anymore, right? They can use digital, and virtual reality is one of them. These are the few things that I feel can be used, and the challenge is there, of course, to create a single network, and zero trust will be very, very critical and important for the healthcare and life sciences.
Let me get Kaustav in, because Kaustav represents an outside-in view, because he is part of the larger ecosystem, but not a healthcare provider per se, right? But supports the entire healthcare ecosystem. Basis what you hear in the conversation, Kaustav, how do you feel the healthcare sector, can enhance cyber resilience while overcoming security complexity? Because see, the challenge with this sector is such: not only do you have several challenges to deal with, the dichotomy of this thing is you have several solutions to manage this also. So you have 100 options. There's probably plenty from both the sides. What is your outside-in view to that? And then I'll probably get Arun and Shubhankar into the conversation.
Correct. So, not just outside-in view, I can also provide you the consumer side of the view as well.
Okay,
as an individual consumer. See, when we talk about the overall digitalization of healthcare industry, I put it into two pillars. One is trust. Second one is consumer experience. Now, do I trust technology? Technology can actually bridge these two gaps. Now, the problem with this is the moment you put more resilient cybersecurity, the user experience will go down. If you keep it less, you are leaving some doors open, and which can bring your trust down. So at the end of the day, again, I'm going back to your example, we need to find a UPI kind of a solution over here, where the common man, a common person, will be able to trust it. The second thing is that when we talk about cyber resilience, there are technology. I can talk about zero trust. I can talk about API integration, multi-factor authentication, micro-segmentation, and all those kind of things. But how we can use these particular technologies without jeopardizing the user experience, and at the same time educating the healthcare provider to use the technology as well. So when I'm saying now healthcare provider, I'm specifically talking about the hospitals, the doctors, and those kind of things. And when these things tied together, okay, we can have a UPI kind of a moment in healthcare.
Right. Thank you so much, Costa. Shumankar and Arun, let me quickly get you in because we've now at the fag end of our conversation. Suhas interestingly spoke about emerging technology that we speak and hear a lot about these days. He spoke about AI, he spoke about augmented reality, virtual reality, so on and so forth. But in reality, how are we equipped? Are we embracing technologies like AI, AR, VR? Is it in the work? Do you see in the foreseeable future it getting implemented? What is the time frame? It's an open question. I don't need a definitive answer, but I'd love to get some responses. Shumankar first and probably Arun.
Okay, the reality is your prescription is with your local medical shop. That is the reality. Okay, you are building systems where your prescription with your medical shop. So, frankly speaking, the total architecture needs to be defined, and it to be compulsion to adhere every healthcare fraternity. So, if it is so, then it's possible to have a secure data, at least patient data, by definition. Okay. So that is the reality, and technology is there. Obviously, AI, ML, all our technologies are being now used for like good UX, user experience maximum, and some of the sensor-based technology are coming, but still they are yet to be a perfect 100. So from clinician sides also, they are not relying that there will be a gap. I understand because the medicines and the medical domain is such, there is a psychology also a big factor between your consumers and your clinicians. Right? Whatever technology is there, that psychological factor will work. So there will be a gap always. So maybe technology from testing point, it's 100% 100% perfect, but for usability point, maybe it will be not a 100%, can reach 90-95% your perfection, because the variations between the clinicians in a single department, in a single hospital is there. So if we go for medicines, there are five doctors are there in an organization. They practices in different ways. So in Indian healthcare, it's in such a way. It's not well standard.
But Suhas gave a great example. For instance, when he spoke about the example of a radiologist, their job is to do the right prognosis or diagnosis, as the case may be, and the imaging, the quality. I mean, I just have the good fortune of knowing certain doctors, who specializes on surgical tools, where a lot of dependence is on the solution per se, which makes them to do a lot of cutting edge, procedures which were not possible in the past. That is where I was coming from. Yeah. So
that is always possible. Yeah. That is always possible, because I told you that technology will reach 100% perfections in that case. But there will be a gap, definitely. There will be
sure. Point taken. So as you wanted to add something.
What I wanted to say is that I did mention artificial intelligence. It's already in play in the healthcare industry, especially with later diagnosis and things like that. Today, you have medical imaging devices. You have various softwares that are running. In fact, you have various algorithms running at an MLDL level that can actually give the person the right information, which is important, right? I am not saying that the person may not be capable. The person is definitely capable, but the errors that can happen reduce drastically when you start utilizing these new AI-based tools. Secondly, when we talk about virtual reality, I did come across a thought of something known as PTSD, right? Post-traumatic stress disorder. And a lot of us go through that. Nobody understands. yes, people in the medical fraternity understand the importance of this, but outside, as far as the patient and the immediate family goes, nobody really takes that and gives that importance to the stress that has happened. It could be because of a surgery, it could be because of an accident, and so forth. In fact, it is very interesting to understand that PTSD can be reduced drastically by using virtual reality. Okay. And it is something which is very interesting, so that the person is made to go through a trauma. There is, in fact, a sense of vibration and sound and also smell which can be actually utilized. And there's a process through which the medical practitioner can ensure that the stress levels reduce drastically. So there are quite a few examples that I can go all across in terms of utilizing these various bits and pockets. It's up to the institutions and the organizations to imbibe this new technology. Not every technology is required to every organization. Not one size fits all, right? It's something like that.
Right. I'll probably I'll sum up today's discussion. You've given your experience and how you contribute, and if anybody else wants to contribute, more than happy to do so. But I'm just conscious of the time. Arun, somewhere, if you remember, my first data point that I shared with you, we heard about how enhancing consumer trust is pivotal, right? So going forward, at the end of the day, all that we're talking about is improving the patient experience, right? Do you really feel, given the conditions that our hospitals are in, healthcare providers in specific, where you are inundated with new challenges literally on a daily basis, is it becoming slowly a business priority to improve the patient experience? And if so, what are some of the things that will help in improving it in time? Over to you, Arun.
Yeah, I wanted to add something on the previous question, as you mentioned about the AI, ML, and the virtual reality implementation into the healthcare. It has become, not only from the technologist point of view, I see that there is a interest from the clinicians point of view as well.
Right.
They are looking AI and ML intervention into the clinical decision support system, CDSS, into the clinical practices. And we are working towards that also, wherein we can provide AI-enabled CDSS into the clinical practice, into day-to-day system. And as Suhas ji is rightly mentioned that, it has been long while where, we implemented digital pathology into the healthcare system. So in histopathology, we have already implemented, when I was there in 2016 in HCG, we implemented the digital pathology across the hospital, because we have that time scarcity of the histopathologists across the hospitals. So we used to send the digital slides for the opinion. Yeah, there is a already initiative. People would be aware that there is a teleradiology concept is becoming popular all across. So these are the technologies wherein the AI ML is becoming more popular, and these technologies can contribute into it. Recently, in one of the discussions in our hospital, and some of the people from the global leaders, they approached us for the metaverse implementation into the virtual surgeries for the second opinion. Okay. So these are the technologies on the way where they will improve the patient experience. Cyberknife, etc. Robotics are also already there in the market. People in the major hospitals are using that technology. So yes, augmented technologies are way forward-looking technologies where patient will get benefited, clinicians will get benefited, and obviously patient will get a better clinical outcome using these technologies.
Right. Thank you all. Thank you, gentlemen. Like I said, I have more questions, but I'm just conscious of the time. I think we've literally close to an hour, and I wish I could continue further. I hope to do that in some other platform, maybe on a physical setup. But for today, it's a wrap up from our end. Can't thank all of you enough. Arun, Shubhankar, Suhas, Kaustav, absolute pleasure as always speaking to you. Learned a lot. Hopefully this exchange of conversations continue. Very healthy debate. Thank you so much for participating today.
Thanks, Aplak. Likewise, learned a lot.